Hello, good evening, all. It's a nice opportunity to talk in front of you regarding Panchakarma for women health. So, there is a short discussion about Panchakarma in women health. So, why women require Panchakarma and what are the irregularities of menstrual cycle will be the objective of my short discussion. So, accordingly, we will discuss the physiological changes in women and how to overcome with the help of Ayurveda. So, what is mean by Panchakarma? Most probably, the when we are thinking about Panchakarma, we just think about the massage and steam factor. But Panchakarma is beyond massage and steam factor. So, we do five different procedures, which are generally known as the purgation therapy, or the emesis therapy, or the enema therapy, Nasyam therapy, and Raktamokshana therapy. So, these are the various Panchakarma therapies which are used in normal as well as abnormal patients. So, normally for to maintain the health of a woman as well as in different components of women health, like there are different hormonal balance entities or the menstrual cycle associated changes. These are commonly found during the reproductive age group of women. Simultaneously, the pregnancy and lactation is also there. And throughout menarche to menopause, we have different women health components. So these are the milestones of women life. And for those different components, we need to treat the patients with the help of Shamana and Shodhana, that is palliative treatment as well as the detoxification treatment in Ayurveda. So detoxification treatment is called as Panchakarma therapies. So in that we already discussed about the five different procedures. So Shamana or the palliative treatment is the only treatment where we give the medicines. Those are generally herbo-mineral medicines or purely herbal medicines, which just suppress the symptoms or signs of the patients. And common symptoms in menstrual regulatories, there are different absence of menses, like very common symptom. The patient will complain that there is no menstrual cycle in this cycle or in this period. So in that case, pregnancy should be ruled out. Very common cause of absence of menstrual cycle is pregnancy. And after ruling out the pregnancy, then we move towards the different causes of pregnancy or different causes of menstrual irregularity. So such irregularities should be treated with different panchakarma also. The commonest panchakarma used in women health to maintain the women health or to treat the menstrual irregularities is enema therapy. So it can be also called as basti in Ayurveda. So another menstrual irregularity is increased or decreased flow of menstrual cycle. So PCOD is the very common uh, uh, disorder which is found in young age group, now starting from 15 to 18 age group, or it may vary from 18 to 40 age group also. So there are different complications of PCOD, that is polycystic ovarian disease. So in this disease, few patients may find the increased flow, or few patients may find the decreased flow of menstrual cycle. So another irregularity is dysmenorrhea or the pain during menstrual cycle. So the physiological, it may be physiological. So just a simple pain is there, and most of the time the patients treat themselves with the help of antispasmodic drugs of allopathy like cyclopam or meftalspas at home only. But in such cases, if patients wants to take Ayurveda treatment, this Basti or enema therapy is very helpful, and we expect that they should treat themselves with the pain factor with the help of enema therapies. Next is dysfunctional uterine bleeding. So irregular bleeding is also observed in perimenopausal period, where there are different causes. Fibroid uterus is one of the major cause where patients may suffer from bleeding at irregular time or It may, the flow may be increased or decreased, and simultaneously it may occur in between two menstrual cycles also. So such dysfunctional uterine bleeding is also ruled out. It should be ruled out with the help of sonography. And if the fibroid uterus is there, then structural treatments are may vary. Sometimes smallest fibroid uterus and not on the or it may be located in the posterior wall of uterus can be treated with the help of some therapies or simultaneously the enema therapies if patient don't have bleeding, excessive bleeding during the cycles. So another is menopause and POF. That is, menopause is cessation of menstrual cycle for more than 6 months. So there is no menstrual cycle for more than 6 months. And another is primary ovarian, premature ovarian failure. This is also very common. Sometimes the patient may suffer from absence of menstrual cycle for more than 6 months at the age of 35 or 30, in between 35 to 40 also. So the function of ovaries to help to support the entire menstrual cycle, but in some cases, in very rare cases, we found that there are the support is not given from the ovary or ovarian hormones. So the ovary stops functioning, and a condition which is similar to menopause may occur, and patient may not get menstrual cycle then after, once the POF is established in her body. So another menstrual irregularity is spotting during menstrual cycle. It may be with the because of pregnancy, or it may not be because of pregnancy. So if after ruling out the pregnancy, we can treat such patients with the help of the enema therapy, as well as one more therapy, that is purgation therapy, is also helpful in women to maintain the women health, because here women health is maintained with the help of restoration of physical health as well as decreasing the mental stress. Nowadays every woman is working outside her home, so and simultaneously she is handling the home stress also. So home stress, work stress, the all the stress factors should be ruled out. So panchakarma para there are some other therapies which are not included in panchakarma, like shirodhara or the shirovasti. Those can be utilized to reduce the mental stress also. So we at Shwas for You clinic are providing all the panchakarma therapies, and simultaneously the therapies which are not included in the panchakarma therapy. So after panchakarma therapy, there are some dietary changes should also be followed, and dinacharya and rutucharya of Ayurveda is need to be followed. It's a need of the hour nowadays, but unfortunately, due to our occupational responsibilities, or the people who are working in the night time, they cannot follow such kind of daily regimen or seasonal regimen. So our diet, our lifestyle should be modified according to our occupation, and that is very important, because there are changes happening throughout the year, like season. There are different seasons as per Ayurveda, as well as seasons as per different cultures and tradition also. So during rainy seasons, we know that our digestion capacity is hampered, and in such cases, we need to improve the digestion and follow accordingly. So the diet should be as per our digestive capacity also. So that is very important. So that even during the menstrual flow, the dietary changes are required to be done, because Ayurveda says pitta dosha is increased during menstrual cycle, and in such cases the medicines or the medicines or the diet which are increasing the pitta dosha or which are aggravating the pitta dosha should not be taken. Like spices should not be taken in large quantity, or the spicy food should not be encouraged or enhanced in our regular day-to-day food during menstrual flow. So such kind of simple tips should be followed. So no hurry, curry, and worry. There, so if you are making less spicy curry, if you are trying to minimize your worries in the life, if you are uh, if you are not so much hurry to complete your task. So these things are definitely reducing your pitta dosha. So such things should be, or such small tips should be followed during our menstrual flow. So these are the few things which I want to highlight here, and I think this is the primary introductory lecture regarding the Panchakarma in women health. But as and when we go on putting our thoughts in Facebook Live or through Shwas for You Clinic, we will definitely segregate every disorder of women, and we will put our thoughts that which disorder will require which kind of panchakarma. So I think I will stop here and will uh, elaborate my thoughts in next sessions or next lecture also. Thank you very much.